Whether you're currently in menopause, approaching it, or just doing your research ahead of time, this video will help you understand what hormone therapy is, what it can do for you, and just as importantly, what risks you need to consider. What is hormone replacement therapy (HRT)? Hormone replacement therapy is a treatment used to relieve symptoms of menopause by replenishing hormones that the body stops producing, mainly estrogen and progesterone. As we age and estrogen levels drop, we may experience symptoms like hot flashes, night sweats, mood swings, vaginal dryness, sleep disturbances, loss of bone density. HRT helps restore balance and relieve these symptoms, often within just a few weeks of starting treatment. Pros of hormone replacement therapy. Let's first talk about the benefits. 1. Effective symptom relief. HRT is one of the most effective ways to reduce hot flashes, night sweats, and vaginal dryness. 2. Bone health protection. It helps prevent bone loss and reduces the risk of osteoporosis, especially in women who enter menopause early. 3. Mood and sleep support. Estrogen can help regulate mood and improve sleep quality, both of which are commonly disrupted during menopause. 4. Better quality of life. For many women, HRT simply helps them feel like themselves again during a time of change. Cons or potential risks of HRT. While HRT can be life-changing for some, it's not for everyone. Let's go over the possible risks. 1. Increased risk of blood clots. Especially with oral forms of HRT, there's a slightly increased risk of blood clots and stroke. 2. Breast cancer concern. Some studies show a small increased risk of breast cancer with long-term combined estrogen and progesterone therapy. 3. Not recommended for certain women. Women with a history of breast cancer, blood clots, or liver disease may not be good candidates for HRT. Is HRT right for you? HRT can be safe and effective when personalized and prescribed carefully. It's important to talk to your doctor, evaluate your personal health history, consider your symptoms and lifestyle. There are also different forms of HRT: patches, gels, tablets, creams, and finding the right one is part of the process. Alternatives to consider. If HRT isn't for you, there are natural options and lifestyle changes that can help, like regular exercise, plant-based estrogen-rich foods like flaxseed and soy, herbal remedies under medical guidance, meditation, yoga, and stress reduction techniques. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and subscribe to Dr. Emily Cares for more women's health content. Leave a comment below with your questions. I'd love to hear your experience with HRT or what concerns you most. Let's keep the conversation supportive and informative. Until next time, take care of your hormones and take care of yourself.